play.
I'll give you 3 tips to be successful in clinical as a SRNA. So, number 1, make a care plan. Read, read, read. Preceptors really like it when you ask intelligent, smart questions. It shows that you've done your research, you need clarification, like read your books, make a care plan. A lot of people, they complain that it's too much work, it requires a lot of time to make a care plan. Look, the point is, apart from generating the paperwork that's required in a care plan, the point is knowing the substance, knowing, the stuff that goes on with the cases that you're doing. Wouldn't it be cool to be able to estimate the time? Let's say you're doing a spine case, right? And there is a time estimate for the average amount of time that it takes from skin incision to get to the spinal disc, from skin to get to spinal disc, 30 minutes, right? And then an hour for each level of spine surgery, whether you're doing a fusion or discectomy. It's really cool to know these things. There's also average blood loss depending on the surgical cases that you're doing, and if you can guesstimate, right? It makes you look smart. It makes you look prepared, smart, and people are really gonna be impressed with that. If you've done some reading, and show your preceptor. Say something smart. To show them that you have done your assignment. You have done your due diligence. Number 2 is come early and come ready to work. Your goal should be to make your preceptor stand back and sit down. The more work you are doing and the more your preceptor is laying back, it means you're doing a great job, and that should be your goal. Take ownership of a patient. You might not know how to do anesthesia, but you know how to do patient care, right? I mean, you've been an ICU nurse before. Take ownership of the patient instead of just standing back. Know your patient's history at the back of your hand. That would impress people. And number 3 is express gratitude. In words, in a card, maybe give a little gift, a thoughtful gift to your preceptor if you have someone that you work with consistently over a period of time, or if you have someone who looks after you and gives you good tips and tricks to be successful as an SRNA. Most preceptors, if not all, are not getting paid extra to teach you anesthesia and to train you. Yes, they sign up for it. It's part of our job. We want to do it, but there's no extra payment for precepting. We don't expect it, but we really, really appreciate it. So express gratitude. Be thankful, and people are gonna want to teach you more. Now is the greatest time to learn everything you could from these different practitioners. May it be CRNAs, anesthesiologists. Learn from their wisdom, learn from their mistakes, so you don't have to make one yourself. If you have any questions, comments, if you have other tips, let me know. Please comment below, subscribe.